Welcome back. Of course, you know that the price of commodities, commodities rather are not the only items affected by, skyrocketing costs in the market. Pharmaceutical products also have in the last few months also been affected due to, forex and dependence on importation. But the president recently signed an executive order, to increase domestic production and to bring down the price. So we're looking at achieving sustainability in that sub-health sector this morning. And joining us to have that conversation, we have Professor Cyril Osifo, who is the president of Pharmaceutical Society of Nigeria, who joins us via Zoom. We also have Comrade Bernard Enya, Vice President to Diabetes Association of Nigeria. He's also the co-chair, National Action on Sugar Reduction Coalition. Good morning, gentlemen, and welcome to the program.
Good morning.
Good morning. Thank you for having me.
Professor Osifo, I believe you can hear me as well.
Yeah, I can hear you.
Yeah, welcome to the program. But I'm going to start from, I'm starting with you, Professor Osifo. That executive order signed by the president was done last month. I wonder if it has been tested and if it has had any immediate impact on importation and perhaps domestic production of pharmaceutical products within the country. Give us some feedback.
Thank you very much for having me. For us in the Pharmaceutical Society of Nigeria, and indeed all pharmacists, we rather the executive order was a welcome development. We were not surprised because there have been some interaction with government, particularly with the Coordinating Minister of Health and Social Welfare. The executive order have been in place for about 4 weeks, but you will agree with me that when policies come out, it will take some time before the full implementation. The nitty-gritty has to be worked out. One of the things I want to say is that when you have zero tariff on active pharmaceutical ingredient, API, medical devices, excipients, and what have you, it will go a long way to reducing the cost of production. However, the price of the unstable naira, dollar will also affect this particular process. The Manufacturers Association actually have cried out that when we have a stable currency or when we have an opportunity to plan effectively, then they will be able to do what they are expected to do. However, I must say that's a welcome development, and we must be a little bit patient, because even if you have to import certain things or you have to order certain things, it doesn't come within 24 hours or it doesn't come within 2 weeks, so to say. I'm sure we'll begin to see the effect of this in the next couple of weeks to come. But at the same time, I believe other agencies have been properly informed, government agencies like that are fully in tune or custom, so as to key into this process so that we have a seamless process of getting the raw materials, particularly the active pharmaceutical ingredients in production of drugs.
Yeah, well, we'll probably return to you to talk to us more about the nitty-gritty that need to be put in place before full implementation. But let me come to the studio. Comrade, I imagine you have some reactions to what Professor Osifo has said.
Yeah, I am one who is living with diabetes. And just a few months ago, the prices of a drug like insulin, it's an injection used in managing diabetes. It used to be 3,500 some time ago. Suddenly, the price now rose to about 22,000 naira. And as I speak to you, I consume 3 of that injection in a month. So for me to be able to keep my drug in touch, which I take every day, in the morning and in the evening. So I spend like 66,000 naira just for the drug. And there's also a syringe, which is used to administering that injection. It's 600 naira. So in a day, I use 2. That's 1,002. If you also time that by 30, you discover that it's about 36,000. 36 plus 66,000 naira is over 100,000 naira just for the drug. And we also know that to put food on the table today is another Herculean tax, especially with families and other challenges. So it has been a very big burden. Now, since the policies at the national is something that, even when the president have made a pronouncement, is not implemented immediately. And our people, the character in our people, the business people, is that once the price of a commodity rises up, it's difficult to come down, even when the enabling environment have been provided. So first and foremost is a very big blow on our side. Now, we don't know how to do this adjustment. As I sit here sometimes, I sacrifice my children's school fees for the drugs because I need to be alive to take care of them. And then by the time you go into what we call a blood sugar check, because I check my blood sugar every day before I go out. In the hospitals, blood sugar check is about 2,000 naira. So when you put all of this together, we are passing through a very big financial burden. So that is why we are coming out here. I'm speaking the mind of 11.2 million Nigerians living with diabetes. We are dying gradually. A lot of us with each passing day withdraw from the prescription because they can no longer afford the drug. Some even without telling their doctor, because the doctor will tell you, no, don't do it. But we usually withdraw from those drugs and then begin to manage with cheaper alternative, which would even endanger our life the more. So I speak here as one who is communicating our plight directly to government. This sensitization is to enable the president, the Senate president, and the senators, members of the National Assembly, who can formulate policies that can help to ameliorate our suffering. Else, we are breaking down with complications every day. You can see the way I am dressed. I don't wear any tight shoe, just to avoid any blister. Because if I sustain any blister here, the wound will not heal. And before you know, amputation will not come. You can imagine me at this my age. I'm 57 right now, only for me to be constrained to a wheelchair because whatever. So we try to be as careful as possible. Now, the moment the price change, it gives us another psychological effect. How do I meet up? What do I put on the table? The minimum wage we are talking about, you need to put that two monthly, to be able to meet up with the drug. And the pressure now goes to my family, my wife, and all other associates. Now, a lot of people keep helping. But the major problem we have in Nigeria regarding this diabetes intervention is the fact that there's no data. The data we even have is sketchy and is unreliable. And when data is unreliable, it becomes difficult for government to take a proper implementation plan. Now, we are living in a society where other people that are living with malaria, HIV, TB, we attend the same hospital. You are doing tests for this person free, you are not doing for the other. You tell me to pay, but the other person, the test is free. In malaria, they even come to the comfort of our homes to give us mosquito net just to prevent malaria. But there's nothing for diabetes. The only intervention from government is just some policies that are not even effective. The Minister of Health did not even know that some hospitals in some states don't even have a DEX officer for non-communicable disease, which diabetes is one of them. Now, if we don't have a DEX officer in the state that will cascade the policies and implement at the state level, then talk of the local government. So we have a lot of persons presenting with diabetes signs and symptoms, but yet they don't have access to quality health care. Instead of me to carry 20,000 naira sometime to buy a drug, I prefer to put a cup of gari and beans for myself and my children. So the situation right now is as serious as any other person would desire to listen to me. That is why the National Action on Sugar Reduction, all we are saying to government and the president is that the sugar sweetened beverages tax, it was approved actually by President Muhammadu Buhari. And the deduction, that was in 2021. The deduction started in June 2022 by the customs and the excise. They are started with that response to do the deduction. Whether it's the consolidated revenue fund or whatever, the money is there. Then suddenly this government, the present government now, we started hearing that they are suspending the deduction. Why? The Minister of Finance told us that they want to stabilize the economy for at least 6 months or so. Now, because sometimes we don't have confidence in what government is telling us, even if they are doing the right thing, because sometimes the moment the pressure is no longer there, they just forget. Now, those of us who make our demand legitimately as law-abiding citizens of the country, sometimes they don't take us serious. But as soon as I make a pronouncement here that person living with diabetes all over the country will bomb Abuja Stadium, everybody now, the Senate, the reps, the police, SSS will come after us. Why do you want to bomb the National Stadium? Because you are not taking care of us. We feel that we are marginalized. Okay. We are rejected. Okay. That is why we are appealing that one of the solutions that will work is the SSB tax. One, it will discourage people from consuming excessive sugar, which is linked to non-communicable disease, diabetes, obesity, cardiovascular disease. There will be revenue for government that they will use and fund diabetes care.
We're going to come to that. We empathize with you. We must say that clearly. I can imagine how it is managing the situation given the economy. And also applaud and commend you for even thinking of others with the policy you're talking about. Prof, I'm bringing the question to you on this particular one. If there's a classic case of effect of government policy, it is seated right here. What's your response?
I quite sympathize with what my comrade is passing through. But it's not just diabetes alone. We also have other diseases that plague Nigerians. And he mentioned cardiovascular problems. We have people with cancer. The prices of medicine, like I said, actually have hit the rooftop. But you see, just like any other commodity, for medicine is special. It's such that if we don't specially take care of it so that we are sure of our medicine security, we may run into difficulties. I mentioned, if you want to set up, the government is saying, let's have about 70% local production. We welcome that because we need to produce our own drugs. And apart from that, we can even export these drugs to the West African sub-region because we are well endowed. But let me say categorically, it may take about 15 to 18 months if you want to start a new manufacturing outfit. And even if you have to import certain things, you don't just, with a click of the hand, get your drugs imported. It doesn't follow that way. There are many things involved, and the necessary agencies, regulatory agencies, will need to inspect, will need to be sure that what you are bringing are well fitting into what we require. But again, I want to say that the regulatory agencies need to be able to come together and kind of do it. There should be a reform in our regulatory agencies so that they can hasten and fast track some of these processes. You and I know very well that it takes, with the present economy, just like pharmaceutical products have also fallen into, you need to probably go to the bank to get some loan to be able to get some of this machinery and equipment down. And that would affect an entrepreneur and affect the whole process entirely. But like I said at the beginning, we have quarterly meetings with the coordinating minister where we discuss these things openly and bring on some of the issues that my comrade have raised. They were fully aware, and we are working closely with government to make sure that these things come up. I agree with him that at times when you have opportunities and price of things have to come down, like the API, when they're on zero tariff, the price should come down. But some unscrupulous element may want to continue to rely on the old price. But don't forget that medicines have expiry dates, so you can't continue to keep them. But importantly, we are discussing with our colleagues and we're having discussions within ourselves such that we can, our activities will definitely affect the common man on the street. And that's where we talk about pharmaceutical care. Right now I'm in Ibadan because the community pharmacists, who are actually the first point of call by most Nigerians, are having a conference and I'm discussing with the executive to make sure that these opportunities are not thwarted, but rather we should work together to make sure that we bring the best to the country. One thing is certain, we don't have any other country but this country. We must make sacrifices. And I can assure you that pharmacists are willing to make sacrifices, including pharmaceutical manufacturing.
All right, Prof, two-in-one question. I don't know how much access, besides the incentive that government has given, maybe reduction in tariff and all of that, those importation, in terms of access to FX, which is key to be able to make these purchases. I want you to speak to that as quickly as you can, because at the end of the day, when the likes of GSK and Sanofi and the rest left, just a few companies leaving and we're literally shaking because we're a high import-dependent country.
The rest left.
At the end of this. Go ahead, Prof.
Country. Yeah. I said that. I said that in passing, but let me be very firm on that. The access to FX to get the pharmaceutical ingredient. You need to go to the bank. Ask.
All right.
Some of the manufacturing. All right. Affect some of the manufacturing of it. But I think we might take it a step further by asking that we provide a special window so that the manufacturing firms will have access to FX and so as to be able to get these ingredients back into the country. And that will massively increase production. That will also massively reduce the price of pharmaceuticals. We are talking with our colleagues in the industry, and they are willing to make sure that the prices of these drugs come down.
Okay, let's come to the studio now. Comrade, I know that you've spoken to the impact of this high cost of drugs for diabetic patients on some of your colleagues. But I wonder if you have a lot more data on the impact on their health. 100,000 naira per day for a diabetic patient is quite high, and we know what the economic realities are saying. Does your association have more data on the impact of these high costs on the health of the 11.2 million diabetic patients that you have quoted?
Yeah, this data we are relying on is like an estimated, data, because the International Diabetes Federation, in their website, they have such data. Now, the challenge within Nigeria is that it's only at the, medical facilities, those who present, because we have diabetes type 1, which is for children. We have the type 2, mostly for adults, and then the gestational for, women in pregnancy. Now, that is where the data we lay our hands on is reliable. Unlike maybe like HIV and AIDS, where we have some standalone kind of testing points, where they just go to the rural communities to do that. That have not been happening now. Now, I will even say I am modest if I mention that figure, because diabetes, hypertension, they have a relationship. A lot of people have access to just checking their BP as against checking the blood sugar. And once you have blood sugar, your blood sugar is high, above the normal range, you are diabetic. And then the number having hypertension. Now, this relationship is what sometimes put together to extrapolate and maybe have an estimated. But we rather require a national survey. I was told that it is on, but I am not really part of it. So that we really want, the data I said is not reliable, but the very one I have mentioned can be verified from the IDF website, and then plus even the Federal Ministry of Health should have this. Now, we are advising, as those of us who are feeling the pain, that they should try to make the maybe the test free. Because it is when it is free that so many people will just be going to the immediate past Minister of Health, Dr. Isaac. There was I think a circular or so that was approved when they had a conference of CMDs of teaching hospitals and specialist hospitals, that anybody who presents to the hospital should be subjected to diabetes test. With that, it can give us a reliable data we can always lay our hands on.
Okay, so the challenge is the data is unreliable.
It's unreliable.
But for those that you know who are perhaps under your association, and perhaps other associations like yours of patients with debilitating health condition, you mentioned cardiovascular, are there any engagements with government's regulatory agencies such that there will be interventions for such patients, like others who are who have HIV and AIDS, who are given free drugs? So are there any engagements with government regulatory agencies, and what is the feedback that you're getting?
We have made frantic effort to do that, but there's a gap. A conspicuous gap is that in most cases, we who are living the non-communicable disease are not involved in the planning. Now, if I take you back to the early 90s, where late Professor Lukoye Ransom Kuti was in charge of the Ministry of Health, there was this model of primary health care where the alma mater declaration that defined primary health care as essential health care based on practical, scientifically sound, and acceptable method of technology made universally acceptable to individuals and community through their full participation. Now, it is the participation that is the gap. Now, they are setting National Health Insurance Authority. And the stakeholders that are put together, we are not there. So the perspective of the people living with that, there's some information I know, not just me, several other people living with non-communicable, that we know. Nobody to make the input at the planning level. And then, when you have only one office of the National Health Insurance Authority in the capital city, how about the rest of the local governments? We have also faulted NAFDAC. NAFDAC offices are always at the state capital. What happened to the rest of the local government? And when we tell them that you lack manpower, they will feel we are, it's an affront or so. But those of us who are practically in the field, do you know that people who present with non-communicable disease in the rural communities sometimes cannot come to, where the specialists are? A good example, I am from Cross River State. For you to travel from the capital city, Calabar, to the other side of the local government, you spend like 6-7 hours on the road. So if somebody will
like
come...
Ogoja.
Yeah, like Ogoja, Boki, or Banliku. If somebody who is sick considers that you will stay in the vehicle without your state of health and travel 7 hours, it means the day you are going to the hospital, you count as one. The day you are going to Calabar. The day you see the doctor, you count as another. And the day you travel, so you use 3 days to go and access services. So we are encouraging the agencies that in the build-up of making some of the policy or whatever, we should be involved. We have so much to contribute toward developing the agency.
All right, Prof, let's bring it back to you. I like the way the conversation is going. It's very practical. So you, I'm sure you were one of those at the table. How far-reaching is all of this policy in terms of what government has done? It's mentioned that let's even leave the urban area, which there's still a struggle because a lot of people who live in the urban area still have issues with drugs and all of that. So when you talk about the rural community, what's the level of urgency that we need that we're not getting at that level? Because these are citizens of Nigeria that are supposed to be protected by the government.
You're right. Our regulatory agency, Pharmacy Council of Nigeria, have put in place supervisory rules of pharmacies, not just in the urban area, to also oversee what happens in the rural area. And there's a deliberate effort to make sure that more pharmacies go go to the rural area, because those in the rural area, like you said, they are Nigerians and they need to access medicine properly. I think we can understand this, especially when government recently inaugurated a committee. I was involved, I was invited, and we are talking about prescription policy or in Nigeria, where we will have prescription drugs, and number 2 would be pharmacy-initiated medications, and then 3 would be over-the-counter drugs. I think we will strategize it just like happens all over the world. Best practices, people can access medicines much easily, so that the physician is not inundated with every type of disease or illness, and they can be referred to, and they can get specialist attention. At times, people come to the teaching hospital just to treat malaria, which could have actually been attended to even at the local government and whatever. Well, with the local government autonomy may improve some of these things we are talking about. I just want to also quickly say to my comrade, they also need to cross-check with the physician that some of the devices they are using are properly calibrated, so that when they check their blood sugar at home, it will be that they are getting the right reading. Because at times when these devices are not properly calibrated, you may have some readings that may necessitate you taking some drugs that may not be necessary. That's just by the wayside. But I think going further is constantly engaging government, constantly discussing with people. And I like what the comrade said. I attended a workshop once in Brussels, and patients, it had to do with cancer, anti-cancer drugs. The cancer patients came and they were part of those that made presentations. And the question one of them asked is, you give us these medicines, you don't care what happens to us. You must be able to allow us to talk to you, give you feedback on what we are doing. I think that's one of the things I believe should come into healthcare. We must listen to the patient to know how they're faring with the drug. We must also even ask questions about the food they eat and things and what they do. If somebody doesn't eat properly and he needs to take a drug with food, a medicine with food, there's no way you can actually do that. You may start having some other effects which are not proper. And so all these things are holistic things that we must consider, that the average Nigerian need to be properly cared for. The average Nigerian who is sick cannot contribute to the workforce. And so when government realizes it, that's why I'm happy that it's not just Ministry of Health, it's Ministry of Health, Federal Ministry of Health and Social Welfare. We must look at the welfare of the populace. That's when we can actually attend to their health needs.
Indeed, a productive conversation, and in fact, it has shown that there are so many other sides to it. Perhaps, the next time we'll have another association representing another class of patients, such that we can, come up close with the realities that they're going through. We want to thank you very much, Professor Cyril Osifo, the President, Pharmaceutical Society of Nigeria. Thank you very much for your time on the program. We've also had Comrade Bernard Enya, Vice President to Diabetes Association of Nigeria and co-chair National Action on Sugar Reduction Coalition. Thank you so much for your time on the program.
Thank you.
And we switch themes now to the softer side of things. This time around, we'll be hearing an angelic voice on the program. Stay with us. We'll be right back.